Inicet important daily MCQs with Dr. Mahboob, that's me. This is a very important MCQ, very conceptual. Stenopic slit is used for first option Fincham test, second option iridectomy, third option corneal tattooing, and fourth option is axis of cylindrical refractive error. To answer this question, we will go with the basics of the stenopic slit. Okay, let's see. What is this? What you are seeing here? You are seeing here a slit-like hole here. Okay, this slit-like hole is the stenopic slit. Okay, this is stenopic slit. Stenopic slit. Okay, this is stenopic slit. Okay, now what is the first option of the previous MCQ was Fincham's test. Fincham's test is a very important MCQ within itself. A person is complaining of colored halos. When he sees a bright light, a person is complaining of colored halos. Okay, suppose a person is complaining of colored halos. Now this colored halos can be because of corneal factor or can be because of lenticular opacity. Okay, this corneal factor is corneal edema, mostly due to acute angle closure, right? So these two are the causes of colored halos. To rule out the cause of this colored halos, we use the stenopic slit. Okay, when we put the stenopic slit in front of the eye, if the colored halos unchanged, that means this colored halos is because of the cornea. That means the colored halos is because of the acute angle closure causing corneal edema. If the colored halos broken, that means it is because of lenticular opacity, lenticular or cataractus changes, right? That is how in Fincham test stenopic slit is used. Okay, now our second option was iridectomy. Iridectomy is nothing but creating a hole in the iris. Let me show you how. Can you see this cornea? This is a central corneal opacity. Pupil is blocked. No light can enter into the eye. If somehow I make a hole anywhere here, anywhere in the periphery, the light can enter into the eye and patient will be able to see. But where to make the hole? Here, here, here in the iris. Here, 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 here. Where? We want to make a hole in such an area, in this area where the refraction, where the astigmatism is low, very less. And to know that astigmatism means cylindrical power, cylindrical refractory error is less. To know that, we use stenopic slit. Stenopic slit will tell you in which axis, in this axis or in this axis or in this axis, cylindrical power is less, astigmatism is less, and that area iris is chosen, is selected for iridectomy. In this case, this area is selected, so here iridectomy is done. Can you see? Here iridectomy is done. This is nothing but iridectomy. Understood my point? This area is selected on the basis of least astigmatism, which is determined by stenopic slit. And astigmatism is nothing but cylindrical refractory error. Got my point? That is how, when we go back to our MCQ, Fincham test, of course, stenopic slit is used. Iridectomy, of course, it is used. and this iridectomy is based on axis of cylindrical refractive error. That is why fourth option is also correct. So our answer for this MCQ will be corneal tattooing. Got my point? Will be corneal tattooing.